Hi, so care and prevention's in chapter 7 now, and we're going to talk about what to do when you encounter an injury. Let me start by asking this. Have you ever been a part of a group of people and there was a job to be done, but no one quite knew their role? And whoever was in charge of putting this group of people together was a poor communicator. And I bet most of you would be like, "Yeah, I know where that's going, and I know where that's been because I've been a part of that." And so, chapter 7 is a really good look at saying to each one of us who are a part of the athletic healthcare team, know your job and do it. And so the only way we know our job is if A, it's been designated to us, and then B, when it happens, or the event happens, or the injury happens, when that injury happens, we will do it. I mean, how many times have you driven by a car wreck and you're kind of like, ooh, I kind of want to see, but if I don't, it's okay, right? So what we're telling you is sometimes in sports injury, as a member of the athletic healthcare team, things are going to look pretty rough. The first time you see a broken bone, you might get a little queasy in your stomach, or a dislocated shoulder, or heaven forbid, something far worse. So let's just go with the fact that, can you be professional enough to take care of it if it happens? That's the first question you have to ask yourself. The second is, what position do I play? What role do I play? Sometimes you're very much involved. Sometimes you're very little involved. But every role is very important. So let's talk about what this is. This is you being able to go in and take care of that injury after it happens. And the steps are, let's have an emergency action plan, a plan. If you don't have a plan, you really don't have much at all. And so we need to know who is going to be involved with the emergency action team, and those people need to know what their role is. And then we need to know what equipment we are going to use, and then we need to know what facility we will be in. And so let's cover just a few of those things real more in depth here. First of all, let's identify some people who will be on our athletic healthcare team and then also on our emergency action plan. Many times as an athletic trainer, I will use not just coaches but also students, especially student aides. They will be very heavily integrated in to what we do. And most of you know this because you probably went to a small school where you needed those people just to fill in some of those positions that you didn't have a paid person to do. And so a lot of times I just need a hand. I need someone else to be there to help steady a player, or help me stand somebody up, or help me to do a spine board procedure, and we'll kind of get into that when we talk about neck injuries. But the interesting thing is everyone can play a role, but there are also times where too many people try to play a role, and that's just another instance and where we can validate the idea of having a plan and knowing who the team is. And so that way, when you have someone coming in off of or coming on the field off of the stands, and albeit they have good intentions, their place is just really not there most of the time. We'll say that. So let's look at some equipment. Equipment is important in the respect that we have it, but then we also know where it's at. It's kind of only as important as it is present. And so if we don't have it there, it didn't matter if we obtained it or not. And a great example of this is an automated external defibrillator. I have some videos below that kind of show you when an AED can be used. I also have a video down there that shows you just how simple most AEDs are. This is of one specific, the one that we have on our Poto campus here, in many locations across the campus. But it's more about the idea that the AED is just terribly simple to use, and I just wanted to show you a video showing you that. But all coaches should be, let me not just do coaches, let me say this, all of our athletic healthcare team should be first aid, CPR, and AED certified. We should not have even a volunteer coach not know the fundamentals of an AED. And training them in them. It's as simple as taking this video, which I uploaded from YouTube, and saying, here, watch this video. You got it? Great. Now, when you need it, it's there. But then also saying, okay, here's a picture, or here's a copy of our emergency action plan. You work in the basketball gym. Here's the emergency action plan for the basketball gym, or for the baseball field, or for the softball field, or for the football complex. You name it. We have one specific plan per venue. And so here's the equipment that we have in that venue, and here's what you're going to need as you go forward and are a member of our athletic healthcare team. So, that being said, what do I do after I have developed an emergency action plan? Well, I need to be able to use it, so it needs to be accessible just like our equipment. Now, one of the unique things is this. When an emergency happens, or when an injury happens, it's very, very common for many people to lose sight on common sense. It's also very common for many people to struggle because the situation is so severe. And so going back to what I said earlier, can you act? Are you a professional that can act? Well, if you are, then you need to keep a couple of key things in mind. First of all, there's a primary survey that needs to occur, and that is to make sure that you, as the first responder in the healthcare team, are safe. Because if you're not safe and you go in to take care of someone, then you get hurt too. Now there are two injuries, and maybe you were the best person to help that person that was hurt initially. So you do a primary survey. You look and you see what's going on, and you make sure that it's safe for you to proceed. Your secondary survey, well, let me go back to this primary survey. On your primary survey, one of the things that you need to verify first is that that person is breathing, that they are not bleeding severely, and that they are not dying. So we're going to check their airway, we're going to check their breathing, we're going to check their circulation. Because if they have an airway, breathing, circulation issue, immediately 911 is going to be our first thing to do, right? We check them. That's that primary survey. We check them, we call 911, and then we start providing care. So in the event that it's not life-threatening and it's something that can be managed, in all likelihood off the field or off the court, then what we can do is we can take them off the field or court and put them into a safe place, and then begin our secondary survey. And that is where we look at them in a systematic way and identify what we suspect is wrong with them. So we do this by saying, okay, we're going to sit you down and we're going to ask you some questions. We're going to ask you about your history first. And then we're going to kind of take a look at that injury, and we're going to observe it. So we're going to take a look at it. And listen, it doesn't take a master's degree in athletic training to identify most broken bones. You can look and you can see that. And so just using observation and using it prudently, you can tell if someone has a fractured bone. The next thing is palpation. We want to be able to feel that and see if there's anything that indicates that something is really bad wrong. But we can, based off of our anatomy knowledge, we can identify what structure is injured, typically just by putting our hands on them if it's appropriate, and finding out where that injury occurred. And then the last thing is special tests. Now, for a special test, you will have to have some training and knowledge. And that is, for instance, if someone tears their ACL, it's going to take some clinical skills, and that's based off of anatomy and time and practice and experience, to know how to do a Lachman's exam. And so as we do that Lachman's exam, and many of you have probably seen this if you've watched sports at all, where an athlete goes down with a knee injury and they're testing that ACL first. To do that and to do it correctly takes practice and time, right? So it's not something that I can expect a lot of people to be able to do. There are some special tests, though, that I can train you to do, and that you can be trained pretty quickly to do. But that comes down to what place and what role you have in the allied health or in the athletic healthcare team. That's the important question to ask. So, that all being said, how often should we go over this emergency action plan? Well, the book and I recommend that you take a emergency action plan and you reevaluate it once a year. You look at it, but then you also practice it. You go through it so that you're ready to go if you're called upon to act. So ask yourself the question, are you professional enough to do this job? And if you are, will you do it by the plan? Because we've set a plan because we know that that's the best way to act. It's built off of not just someone thinking that it's the best way, but probably because they've experienced and they know what the best way is. Let me know if you have any questions. Talk to you soon.